Over 4,000 patients walk through these doors each year.
The doctors here, they're wonderful.
I'm grateful for the staff and the clinic.
The circumstances that bring a patient here for the first times really sometimes tug at your heartstrings.
When I'm here, I feel wanted.
Service, volunteerism, community.
This is the neediest community we can possibly serve.
I feel like I'm getting great quality care.
Our clinic was founded in 1987 and really reaches out and provides a medical home for low-income and uninsured patients throughout Greenville County. They really are able to access a wide variety of comprehensive health care services. We have primary medical services. If they need a specialist, they're able to see a specialist. We have dental services ranging from dental hygiene to some basic restorative to extractions and treatment of acute and infections, as well as a pharmacy that provides many times the very life-sustaining medications that folks need depending on what their diagnosis may be. Our volunteers are terrific. The physicians, the dentists, the nurses that give their time to make sure our patients have someone who cares about their health and make sure that they have access to care when they may not have any other options.
Lean you forward all the way in.
I think that we are very fortunate in the Greenville community to have such a group of physicians and pharmacists and nurses and health professionals, dentists that care about others and that are willing to take time out of their schedule and their busy lives to give back, not just to the individual that they're serving, but the community as a whole.
We do depend on the people and the providers in this community to give their time and to give their resources. The government does not fund the Greenville Free Clinic. We don't receive state funding, we don't receive federal funding. The community completely supports, and that's through United Way, that's through churches and donations, that's through fundraising events.
And is it in your growing area too? Or just...
I get more out of coming to the clinic than I ever thought about giving to the clinic when I come. Patients are just so thankful to have volunteers come do what we enjoy and are trained to do. Most dentists, including myself, actually enjoy the field of dentistry, and so it's nice to give it away to people who truly need the dentistry, have nowhere else to go, not have to discuss fee plans with them. It's just nice to come in and actually do the dentistry that they want. And they're so grateful to have it done.
The pharmacy that I get, the help with the pharmacy, it costs me about, if I didn't have the help here, it would cost me about $500 a month, and my medicines. And I know doctor visits are very expensive nowadays and they want their money up front. And the help that I get here is very, very, very thankful for. I'm very thankful for it.
She came to see me yesterday and she had cut down a little bit.
It is absolutely essential and critical to the care of the patient to have a venue that you could truly define as a medical home in which the total care of that patient is provided. Access to ancillary services, access to preventative services, and access to diagnostic services, and access to treatment services.
When I leave the clinic, I'm always thankful, as you are when you really do mission work, for what I have, what I've been given, where I am in my life, and the fact that I don't have to struggle like some of these patients. I never walk out of here and think, that was hard. I walk out of here feeling very blessed for what I have and what I am, versus some of these patients in here that are fighting for mere existence in life.
If the free clinic wasn't here, all these people that are sick and don't have money to go to the doctor, they probably wouldn't be making it. I mean, seriously, because there's a lot of people out here that's real sick, and if they didn't, well, if they wouldn't be able to come here to get the help and the medicines that they need, they wouldn't be making it.
The need is terrifically great these days. The economy has brought in 30, 40, 50% increases in the number of patients coming to us. And the only way that we are there to provide the care that those patients need is because the community is there. There's ways to get involved by volunteering. Certainly financial contributions are always welcome and needed just to make sure that our volunteers have all the resources at their disposal to treat our patients.
Everyone here has the feeling that they need to give, and they give of themselves, of their time, and of their money. And I don't know if it has to do with the fact that we're in the Southern Bible Belt or what it is, but people here feel like they have the need to give. And this is just such a great, easy way to give.
I just thank God that there's someone out here that can help people that don't have the means to get their medicine and treatment.